by mandating the vaccine, we know that if you're vaccinated, if you're asymptomatic, you cannot spread the virus. So I think that's really important issue that has to be kept in mind.
Welcome to the RANE Insights on COVID-19 podcast. I'm Emily Donahue. Let's listen as RANE founder David Lawrence speaks with Drs. Fred Southwick and Bill Lang for our weekly coronavirus update.
Fred and Bill, thank you once again for spending some time with us. Looking past the week, certainly one of the topics is the continuing data around the world and particularly around the Delta variant. What can you share with us?
Well, I think the biggest thing that we're seeing with the Delta variant that concerns me is what has happened in the United Kingdom. In middle of May, the rate in the United Kingdom, actually the number of cases in the United Kingdom was just north of 1,500 cases per day. That's cases per day, total cases per day. The last 2 days, the United Kingdom has been over 15,000 cases per day. And this increase in cases has paralleled the growth of the Delta variant, which is now the predominant variant in the UK. In the United States, the Delta variant has gone from 6% about 2 weeks ago to now something on the order of 20%. And that's consistent with what we were told is that the doubling rate is going to be about 10 days to 2 weeks. What that implies is that by the middle of July, we are probably going to be at Delta variant being the primary variant in the United States. So the question that arises then, we're down in the United States to right between 3 and 4 cases per 100,000 per day. Are we going to go up 10 times the rate? And I think there's some reasons why not, but that's the big question that we're going to have. I'll stop there for a minute.
Yeah, the Delta mutant, if you look at the reproductive rate of this particular virus, the estimate now is, remember the wild type, one person infected 2 to 2.5. As far as the Delta mutant, one person can infect 7. So it is a reproductive rate of 7. It's much, much more infectious even than the Alpha variant or the UK variant, which had a reproductive rate of about 3.5 to 4. So this explains why it's spreading so rapidly and taking over so quickly. And the good news is both the Moderna and Pfizer, if you receive both doses, the vaccine will protect you. It's about an 83% efficacy for mild to moderate development of mild to moderate disease. Our problem is the same, I think, as the UK. Young people are not getting vaccinated, and there are outbreaks now in southern Missouri that it's really taking off, and actually all of the beds in certain ICUs in that region are actually filled, and they don't have enough nursing or healthcare capacity. So I'm very concerned there is going to be a new surge, and the surge will occur among those who are not vaccinated, and the primary variant will be the Delta variant.
Dr. Walensky, the head of CDC, she said earlier this week that severe disease and deaths are an entirely preventable phenomena. They're preventable if people get vaccinated. And that's the concern right now is can we get the word out? Now, I guess you'd call it the good news in the UK is that they are in fact seeing this surge, and younger people are starting to step up to the plate and get their vaccination because they are seeing the cases happening. But the other thing of note in the UK is while they're having this tenfold increase or nearly tenfold increase in cases, the deaths have not budged. They're still looking at low double digits, 10 to 15 deaths per day in the entire United Kingdom. So the Delta variant does not seem to be more lethal, but it is incredibly more infectious. The one other point on the infectivity that I find very interesting was the Australians, where it's becoming predominant in Australia also. They have low double-digit number of cases for the entire nation. And they also have a highly instrumented retail sector, lots of closed circuit TV cameras, and so they were able to track the people who were carrying the transmitting the disease. And when they tracked them, they found that oftentimes the contact was fleeting. Walking by someone who may have coughed or sneezed in a retail store or in a mall, that was all it took to transmit the disease. So it is much more infectious.
Yeah, and if you look at the household contacts, the experience in India is that the wild type virus, which we've experienced, about 50 to 58% of household contacts become infected when one person who is infected comes in. In the case of the Delta mutant, it's more like 90 to 95% of household contacts become infected. So this is a whole new ballgame, and one of the problems is I'm not sure the mask will help some, but they won't help to the extent that they did with the wild type virus. And so in my estimate, the only way to be sure to be protected is to be vaccinated.
And I just wanted to underscore the point here that the objective is, when we talk about efficacy, or when you have spoken about efficacy, it is not just simply whether or not you would contract it, but if you did, whether that would lead to hospitalization or death or other forms of serious respiratory illness. And I think that's the point that both of you have made.
Yes, and the efficacy as measured was mild to moderate disease. With regard to protection from severe disease, hospitalization, and death, it's very close to 100% protection.
Okay, and let me just reiterate, because part of this is the takeaways here, is that unlike the original strain of COVID-19, the Delta strain seems to be, I'll use the word, impervious to some of the social distancing and mask wearing precautions that were previously employed with a fair degree of efficacy. That's what I'm hearing you say.
Yes, I agree.
The issue of vaccine reticence. You mentioned the young population's been reluctant to take it. We know certain communities have viewed with suspicion government-sponsored vaccines, particularly ones that seem to have received approval on a fairly expedited basis. And yet you're also seeing hospital workers. There's been recent litigation. It's not just at Houston Methodist, but there are several hospitals that have now been told, they've told their workers, don't come into work unless you have been vaccinated. And yet, certain populations, frontline workers in these hospitals have been reluctant to take the vaccine, notwithstanding the fact that the doctors in these hospitals have stepped up. Maybe you can help unpack what else you have learned about the reasons for reticence, and maybe some ideas about how to overcome the reluctance. And I raise this because there are many companies, as we've discussed previously, who are trying to get their policy right, would like to see all their employees vaccinated, and yet even some of the most sophisticated companies in the world have personnel who have been reluctant to take it. What else have you guys learned about, again, the reasons and some of the ways that might overcome this reluctance?
The biggest reason that I'm given when people talk about why they're not wanting to get it is they say that how could we trust a vaccine that was rushed to market in just 5 or 6 months when a vaccine typically takes 7 to 10 years to get through the development and approval process. And they say they just don't trust it because of that. My main response to that is this is not a vaccine that was developed in 5 months. This is a technology that has been in the works for over a decade, well over a decade, and they're applying this specific protein, the spike protein coding, to the technology, but it is not a fly-by-night technology that was just plucked out of the air. This is the result of years and years of research. So how do you counter that feeling with people that are in your business or people you run across or in medical practice for me? And the way I counter it is the education, is just going through and teaching people that this is not something that was developed off the cuff in just a few months, that it was a product of research. That's number one. I'll leave Fred to have one.
Great. Bill, I do agree with you. And one of the big differences is that the company started manufacturing the vaccine before they had even started. They were beginning phase 2 of the trials. Normally, they would never take a chance doing that, because if the trials failed, they would be left with huge investments that would not pay off. But the government covered them for this manufacturing. And this explains why it was released so quickly. For instance, the polio vaccine, after Salk had developed it, it took over a year to ramp up the manufacturing. So I think that's a key element. Another concern there are people that just because of the anti-vaxxing through the social networks, etc., don't want to take any vaccine. We have seen this with our nurses with influenza vaccine. And there's a certain percent that will not take the influenza vaccine, and they are willing to wear a mask throughout the day and not take the vaccine. So there's a group that's very stridently opposed to vaccinations, and it seems to be not physicians are rarely that way. It seems to be in nurses and other levels of the healthcare workers that seem to have embraced this anti-vaccination. And I think it's almost impossible to convince these people, because their entire life they've been opposed to vaccination. And I think the only way is to mandate. Now, one of the issues and why healthcare workers should want to take the vaccine is they are working with patients. If they were to get asymptomatically carry the virus, they could give it to their patients, and they could cause serious harm, something none of them want to do. And the hospital doesn't want to do that. That's a liability issue for them. So by mandating the vaccine, we know that if you're vaccinated, if you're asymptomatic, you cannot spread the virus. So I think that's really important issue that has to be kept in mind.
Well, we don't disagree often. I'll disagree a little bit here. I think that there are certain settings where vaccine mandates are appropriate, a hospital being one, because you can't control whether a patient coming in is vaccinated or not. And it is just not right for the caregivers to potentially be infecting those patients who are coming in for care, regardless of whether they've chosen to be vaccinated or perhaps they actually have a medical or religious reason why they haven't been vaccinated. But in other settings, I have trouble with mandating, especially an authorized but unapproved vaccine, when the vaccine itself is so protective. We're, as Dr. Walensky said, that this is now a fully preventable disease, and the only ones who are really putting themselves at risk are the ones who are choosing to be at risk. So in that setting, I don't feel like mandating it in the workplace. Schools they may be a special case like hospitals, but at the workplaces, I don't feel that mandating it necessarily is the best way to go. One other reason on that is when we had looked at vaccines in the past with workplace mandates, including the anthrax vaccine, what we found was as soon as you mandated it, the resistance levels went up. If it was in short supply, everybody wanted it. As soon as it was mandated, the resistance levels were much, much higher. So I think that education is an important way, except for those unique settings like hospitals and potentially schools.
Yeah, I agree with you on that, Bill, in general, but keep in mind there is a population in every society that are highly, highly resistant to taking on anything new. And therefore, those individuals will not be susceptible to education. They create an actual barrier to any information that conflicts with their preconceived concepts. And so that group, just know that you will have a population that will insist on not being vaccinated if you don't mandate. That's just important. And then you have to design your program to take into account that population.
No, that's correct. That's correct. One of the companies that I work with, they read all the data and they said that they want to essentially mandate. And what they did was they're saying, in order to protect our workplace, what we are going to do is we are going to require, if you are not vaccinated, you must wear a mask at all times when you're in the workplace, and you have to test with a point of care molecular test every single day. You have to wait in a waiting area on deck circle to get the result before you're allowed into the workplace. And what happened was they went from having about 85% who had voluntarily got their vaccine to they're now 98% vaccinated, because they just made it they made it such a hassle not to be vaccinated that people just said, "Oh, the hell with that! I'll get the vaccine."
I think that's a great strategy. Actually, I agree with that approach. The other thing you can do, remember, the company has to pay for all these unnecessary tests because that individual won't get vaccinated. Should that cost be paid by the employee?
That's a great question. The company in this case was paying for the tests, but you're right. If the employee has a way of getting the vaccine, because remember, employers under the Occupational Safety and Health Act are required to provide a safe and healthful workplace. And so anything they do, in terms of vaccination or masking or testing, that to provide a safe and healthy workplace is totally reasonable. But once the vaccinations are freely available, anybody can walk down the street and get it, as is the case in most of the United States, then you have to ask yourself, has the company complied with their obligation? And if the only ones not vaccinated are those who have chosen not to vaccinate. And yes, you have to make accommodation for the people who are allergic or have deeply held religious reasons for rejecting the vaccine, but that's a very, very small number.
One other little wrench is the Delta variant, in that masks and distancing, the techniques that were used by companies before, will not be effective. That will mean they will have to test every single day to assure that no one comes into their environment who has developed this, contracted the Delta variant. And that's going to logistically very, very difficult situation.
That's right. One other issue that brings up is how effective will the Delta variant be at transmitting from people who have been vaccinated? We do know, such as the situation with the New York Yankees, where they had 7 people who were infected. We don't know the variant. At least I don't know the variant on those 7 people. Only one of them was at all sick. 6 of them were not at all sick, and in fact, none of them transmitted to anybody else. But will that be the case with the Delta variant? And I don't think we know yet. I know the Australians are looking at it, but I don't think we know the answer on that yet. I said the Australians. I'm sorry. I meant the Israelis are looking at that.
Let me just jump in, because one of the things that we have discussed in the past. Okay, is that better, Emily? Okay, sorry. Something we've touched upon in the past, because I'm hearing sort of absolute certainty from both of you in terms of the importance of getting vaccinated, the safety, the efficacy, etc. And I'm also hearing a fair amount of frustration. Fred, I think the term you used was these people, there's a certain percentage of the population that's been against vaccinations in general, and there's no convincing them, or there will be no convincing. Some of this is not, it can't simply be we'll call it the evidence or the data or the messaging or the fact that so many people have been vaccinated and it has proven to be both safe and effective. There has to be an issue here in terms of the messengers who are carrying the message forward, and a lack of trust that, notwithstanding the scientific data, that people just don't trust it. And so I'm not going to call out names, but there are professional athletes who are highly sophisticated, highly accomplished, not only in their sports, their chosen sports, but actually in the business world, who also made decisions not to be vaccinated, and then it's come out that, you know, they're in the COVID protocol as a result. And so what else do you think our government has to do? What else do you think the business community has to do? What else do you think the not-for-profit organizations, media, etc., has to do, other than get the facts out, but in terms of finding the right messengers?
Well, David, this problem comes up. I work in quality and safety in healthcare, and we're often creating protocols that make patient care safer. And when we design these, we show that they work, and then we ask physicians and other healthcare workers to follow those protocols, and they don't do it. So this is a common problem of implementation science. And as I mentioned before, it's well known that there is a small group. They're either called traditionalists or laggards, if you want to be more derogatory, who will not accept change and will fight to the death not to make the change. And so I don't have a good solution, and I don't think anyone that I know of has a good solution for that particular group of individuals.
I think that one of the most powerful arguments is that we've delivered now almost 3 billion, with a B, vaccinations around the world. And yes, there have been some side effects. Those side effects have been, relatively small in number. They've been identified. Risk mitigations for those risks that have been identified have been put into place. But 3 billion vaccinations into it, that's a hell of a lot of data. So we have a real good idea of the safety of this vaccine, and now we also have a really good idea about the efficacy of the vaccine. But we need to get to people such as faith leaders, sports figures, musicians, unfortunately, oftentimes it's getting to various kinds of artists that people are going to listen to, because they're thinking with their hearts, not with their heads, and you need to get the people who are going to speak to them at that level.
Yes, I agree with Bill. Personal narrative, personal stories, friends that got infected that didn't get vaccinated, stories like that occasionally can bring people around. So I think that is one tactic that can be used and might be effective.
USA Today had a series either early this week or over the weekend that was talking about it was talking of cases of exactly that, people who had put it off and they died, or they were very, very sick. One of the stories was of someone who had put off getting his vaccine. He was even someone who was open to getting it, but he just didn't think it was important, and he ended up with a double lung transplant. Those kinds of case stories are going to be powerful, especially as Delta begins to once again increase the case numbers that we're seeing.
Switch gears. Both of you have been discussing new data, new evidence in terms of expanding the population who should be vaccinated. And I think there's some more data about under 18 individuals who are under 18. Can you maybe shed some light on that as well, and what it is you're generally following right now?
The biggest thing that is an issue with the under 18 population is, as we kind of discussed earlier, is this population generally, even with the Delta variant, are not getting severely ill, are not dying of it. So they're looking at these risks that are out there, the risk of myocarditis, which is a small risk, but people don't think, they just hear the words, they don't think about the rates. But they see this risk. And then they see that, well, what's my individual benefit? And they say, well, my individual benefit is pretty low. They don't think about what it means to get this virus under control for everybody. And so what's the public health driver for getting everybody, including the under 18s, vaccinated? Because it doesn't have a significant direct benefit for them that they perceive as being higher than the risk of getting of the vaccine.
Yeah, the risk of myocarditis is about 1 per 100,000 of those 18 and younger who become vaccinated. And the good news is that the inflammation of the heart is very transient. It only lasts 3 or 4 or 5 days. There's no evidence of any permanent damage. So yes, it is a side effect. Yes, we wish it wasn't there, but it's not a permanent and does not cause permanent impairment. And a point that's been made by pediatric infectious disease physicians is the coronavirus itself does cause myocarditis, which can be very severe and can result in permanent damage. Therefore, the risk of developing myocarditis from the vaccine is far lower than the risk of developing myocarditis as a consequence of the SARS-CoV-2 virus.
And just as a final note for today's conversation, as you look out the week ahead, 2 weeks ahead, the potential for new vaccines coming into the market, other questions about the efficacy of existing vaccines, what are you advising your clients in terms of as they begin to start to reopen, whether they're businesses, government agencies, et cetera? What should they be doing?
My approach is what I discussed earlier, that I think that we've gotten to the point in the United States, at least, where anyone who wants to get vaccinated can walk down the street or call and make an appointment and get vaccinated today, generally speaking. Once we're at that point, then for businesses, including retail, including performance-oriented or competition businesses, go for it. And people need to they can take their risk themselves. If they're not vaccinated, it's on them. I think you advise them that anyone who is not vaccinated should wear a mask, should try to distance, but as we are learning, that may not be as beneficial with the Delta variant. So I think that's the biggest thing that I'm telling people is we have the vaccine now. Use it, and if you're vaccinated, then you're pretty much out of the woods.
Yeah, I agree with Bill. If you think about it, if your employees are all vaccinated, you have a competitive advantage. Those individuals will not get sick, will not miss work, will never have to be quarantined or isolated. And they will not have large medical bills if they get sick, which would put up the premiums on health insurance. So from a competitive standpoint, having everyone vaccinated is a competitive advantage. If the Delta mutant really takes over and the R sub 0 is 7, I would recommend that those that are not vaccinated work and don't work and distantly work virtually, because I don't know that you're going to be able to protect individuals in the workplace that are not vaccinated.
I think these are great points, and I'm sure will be appreciated. And the irony is both of you have pointed out that the people who, within businesses or different agencies, who are most upset about returning to work and not knowing whether everyone is vaccinated are the people who have been vaccinated and, of course, are the most protected. And the people who are most at risk are the unvaccinated. So it's an interesting, almost variance in and of itself about who's worried about this. and we've heard from many clients amongst the vaccinated who want everyone vaccinated before they come back to work. And of course, again, the people who are most at risk are the ones, as you pointed out, who have not been. But I think some very, very helpful insights about the Delta variant, helpful insights about even if one contracts the virus, you're avoiding hospitalization and serious consequences. And then most importantly, that the science and the data continues to support both the safety and the efficacy of the vaccine. So thank you, Bill. Thank you, Fred, again for sharing the insights and for following the data so closely. Look forward to speaking next week.
Thank you, David.
Thank you, David.
Thank
Take
you.
care.
Dr. Bill Lang is an expert in public health responses to biological incidents, including pandemics. Dr. Fred Southwick is an infectious disease specialist at the University of Florida College of Medicine. Both doctors are part of the RANE Expert Network. Individuals and organizations turn to RANE for risk intelligence that cuts through the hype to focus on what they need to know, what to expect, and what to do. Sign up for our coronavirus solution and get critical information on the COVID-19 pandemic delivered daily. Visit us at ranenetwork.com. That's RANE network.com. I'm Emily Donahue. Thanks for listening.